Hi, my name is Chelsea Wrighton, and I will be doing my IV test today. So I have my MAR here. My patient is James Wilson. So it says here that all of his vitals were taken. I have an order from the provider to administer an IV. Let's see, so I'm gonna gather my supplies now, doing my first med check as I do this. So first I need to get the 500 milliliters of sodium chloride. Here we go. So here's the 500 milliliters sodium chloride, 9.9%. I'm just gonna set this here on a table, and normally I'd have a tray. I'm just gonna use this for now because I don't see any other trays. Okay. So now I have the levofloxacin, which is in a 250 milligrams in a 50 milliliter bag. Making sure that I grab the right one. Levofloxacin, 250 milligrams per milliliters. It is not expired, so I can use that. I'd also check the expiration date of this one as well. Also beforehand, I would note that he has allergies to NSAIDs. However, none of these are NSAIDs, so there won't be any allergic reactions we're going to be given to James. So moving on, for the IV push, so it's a PRN for pain rated greater than 4, and in my report given to me by the other nurse, it says that his pain was rated a 6 out of 10, so I can go ahead and give that to him. So we are giving him hydromorphone, 1 milligram every 3 hours PRN. And according to the drug book, and right here it also says 1 milligram per milliliter, so I would just be giving him 1 milliliter. So the expiration date is in 2025, so we are good on that as well. So I'm gonna put this on my tray. So next I will need, let's see, this is a 5 cc, however, I just need, 3 milligrams of the sodium chloride, or not sodium chloride, the saline, and then 1 milligram of the hydromorphone. I'm sorry, I'm not going to save the earth because I'm paranoid. I apologize. Otherwise I would. But I'm also grabbing the syringe caps. Let's see. Oh, also while doing this, I would make sure I have the right patient, right medication, right dose, right route, right date. Wait, let's see. Patient, medication, dose, route, time, date, documentation. Yes. All right. So moving on. I'm gonna set this down on my handy dandy little tray here. So I got the 3 syringes. I have the tips. I'm going to grab some alcohol wipes, maybe a little more than I need because safety purposes. Can never be too clean, I guess. I'm gonna grab a couple of these IV catheters, just in case I mess up. So I'm gonna also set that down on my little tray here, as well as grab some of the tubing labels. And then I'll have the 2 saline flush labels as well. And then I have med labels over there. Let's see, so now I can grab my extension set. Yeah, I already looked in there. Okay. Extension set, the IV start kit. I will grab, we don't need that. I will grab primary and secondary tubing. Also, I'm not sure if I did this beforehand, but I would have washed my hands before all this preparation. Let's see. Okay, so backtracking. I got the start kit, extension set, primary tubing, secondary tubing, primary bag, secondary bag, medication, syringes. I think I'm good. Good to go. So, as I'm preparing this, I will do my second med check as well. I just had my mouth. Okay, so let's pretend that my tray is a little bit bigger so none of this touches the table, so we don't have to break the sterile technique, because nobody would want that. All right, so hand hygiene first. Let's see, so I'm doing my second med check just to make sure I have everything. You know what I forgot to grab? I forgot to grab some saline for my saline push. This one's a little empty, so I'm gonna grab one that has more. Here we go. So I got the saline. We are good now. All right, putting that back onto my tray and doing hand hygiene one more time because I can never be too clean, right? Yeah. Okay. So now, to begin, I'm going to take an alcohol prep pad, and I should probably have the garbage right by me. We're just gonna steal this one, pretend that it's in the room.
Sorry about that.
There we go, it's all good. Because I touched the garbage, I'm gonna do hand hygiene one more time. Probably do it like 15 times throughout the video. It'll be fine. Okay, so now open up the alcohol pad. Since I touched my face, I'd do hand hygiene again. I apologize. Okay, so now I'm gonna start with the saline syringe, saline flush. I wouldn't reach over my thing. Okay, I dropped that. Let's try that again, shall we?
That's why we grab extra.
That's why we grab extra. Sorry, planet, I'm producing more waste, but it's fine because we're being clean. Okay, so I'd clean that for roughly 30 seconds. I would take my syringe, if I can get it out of the package, that would be great. Here we go. Did it. All right, so taking it out of the package, making sure not to touch the inside of the package because that is sterile. I'm going to label my syringe, making sure not to cover up any of the labels. So this will be my saline flush. All right, so I wiped off the top of that. Now, make sure the needle is on tight. I would inject some air into it first. So the top is clean, injecting air, flipping it upside down. Now I injected the air. All right, so now I'm gonna draw up 3 milliliters. Flicking out any of bubbles. Flicking out any bubbles. All right, see, I drew up 3 milliliters of that. So now I can go ahead and cap this with the bottle because I don't want to stab myself. Now I'll be taking a syringe cap, making sure not to touch the inside because sterile technique. All right, so now I'm gonna unscrew this needle if I can. There we go. Drop that in the sharps. Now I'm going to take the cap, twist that on. Perfect. I wouldn't reach over my thing. All right, now I'm going to put it back in the packaging and put that back onto my tray here. All right, next we will do the med. So I'm going to actually write out that label first. I got my pencil here, so I'm going to write out the med. It is hydromorphone. Um, 1 milligram and 1 milliliter. So then I will do the date. It is the 6th of November at 0800. Then I would do my initials. Oops, I'll do all 3 of them just because. Let's see, so I have date, time, dose, initial, name. Yeah. All right, so I'm gonna place that there. Now that I have this, I'm going to take my, sorry,
No, you're good.
take my syringe, there we go, to draw up 1 milliliter. So I'm going to take it out of the package, making sure not to touch the plunger so I don't get all my germs on there. Before I begin, and before I forget, I'm gonna label my med. We're just gonna put it upright like that because we can, and it's not covering up anything. Well, it's kind of hard to stick it on. Okay, so I got my label all good. Sorry, I'm a little shaky right now. There's my my med. There we go. So I'm gonna take an alcohol pad. I will clean off the top. About 30 seconds. Did that? Okay, so now that is dry, I did 30 seconds. I don't want to take off the needle. I would like the needle. So I'm gonna put some air in. Make sure not to take the needle off. Okay, we're good. So now I will inject, if I can, there we go. Inject the needle, push my air in, and then I will do 1 milligram. Trying to get that little bubble guy out. Let's see. There he goes. All right, so let me make sure I got 1 milliliter. There, so the bubble is out. So now I will recap this needle, and I will take this handy dandy little syringe cap just to prepare myself. So open that. All right, now I can screw off the needle. Maybe let's try it this way. Hey, dispose of the needle. All right, putting on the syringe cap. We are good. I have the 1 milliliter hydromorphone. So I'm gonna be putting that back into my package. Put that back onto my tray. And now I can do my last saline flush. Almost forgot what it's called. All right, so now just to be safe, I'm going to do another alcohol wipe here. Probably end up grabbing some more before I go into the patient's room. So I am going to take my syringe out of the package, set that down right there. Make sure not to touch the plunger. Put some air in. Oh my, that didn't happen. Okay, we're good. All right, so then I'm gonna take off my cap, set that down there. I have my saline. I'm going to inject it into the bottle. Now I'm gonna inject my air, take out 3 milliliters. And it has a nice vacuum, there we go. Nope, I don't want 2.5. I would like some 3 milliliters, please. And thank you. Oh, come on. Let's try this again. Okay, so I've drawn up the 3 milliliters. I will recap. Here's my cap. Okay, I thought I lost it for a second. I will safely recap the needle so I don't stab myself. I'm going to take the syringe cap and I will get the needle off, potentially. There we go. Throw that in the sharps. Put my syringe cap on, not touching anything in there. I will take my label and I will label the syringe. Okay, maybe I would have done it like this. Okay. All right, so there's 3 milliliters of that in there, the saline in the syringe, I should specify. So now I did my first and second med check. And I might as well just label my tubing because why not? So I'm labeling it with the date. It is the 6th of 2019. I'm gonna say it's a primary. I'll put NS for normal saline. By me, CMR. Let's see, date. Okay, I'll do time as well. It's 0800. And I'll do the same for the secondary. And that is levofloxacin. And I should probably add the milliliters as well. Let's see, 50 milliliters. Yes, we are good. Okay, so CMR, that is my initials, 0800. Perfect, that is the time. All right, so now I'm going to bring the garbage over here. I'm going to, get some more alcohol wipes because I used a few. Okay, so there's my tray. Excuse me. So I'm gonna do some hand hygiene one more time. Sorry for stepping on your phone.
No, you're good.
Okay. All right. So now I will take my primary bag. Excuse me. I will hook that up. Okay. So this is outside the patient's room. So I'm gonna take that, pretend it is outside of the room, if it will allow. There we go. So I'm hanging up my primary bag, and that is already labeled, so I wouldn't have to label it already. Now I'm gonna grab my primary tubing. Yeah, here we go. Right, there's a perforated side, not sign. All right, let's try this again, shall we? We can throw that boy away. And I'm sorry, I called it a boy. That was just out of normal habit. I wouldn't do that in real life. I'd be more professional. All right, so we took off that as well. I'm going to clamp this shut. Excuse me. All right, so I'm going to take this cap off. Spooky there.
Spooky.
Throw that thing away. Alright, so I took off my cap. I'm going to squeeze the drip chamber a little bit as I pierce my bag. As I spike it, I should say. Making sure not to touch the part that goes in it. Let me try to advance it a little more. Perfect. So now, got that closed. Alright, so now I'm going to unclamp my tubing. Let that run, but before I do that, I'm going to take this thing out so it can run. Alright, so look at my bubble. Alright, so now I'm filling up the Minnesota, making sure there's no air bubbles in that. It is filled, so I can go ahead and flip. I'm going to put that inside there, ensuring there's no bubbles in the first half of the primary tubing. Getting all the bubbles out of this because we don't want air going into our patient. Not today, not ever. All right, come on, no bubbles. Alright, to save some time, I'm just gonna unscrew this cap, making sure not to touch where it goes in. Just kind of let that drip in there. Alright. Put that back on so don't lose. Alright. However, I see some more bubbles. I'm gonna flick those out. Just make sure that does not touch the garbage can. We do not want that to happen. Flicking the bubbles out. They're not wanting to cooperate with me. There we go. Just had to double check that. Alright, let me try this one more time just to make sure. You know, every time I practiced, I didn't have this many bubbles. So, just my luck. This would happen. But it's fine. We're making it work. We're getting the bubbles out. I wouldn't touch the end of that. At least nothing spilled all over the floor. That's a good sign. Alright, so this is going back on. Oh! Just kidding. Okay, so I wouldn't have thrown that away. But let's pretend that I didn't. If I were to, would have cleaned this off with alcohol to make sure that it is still sterile. Oh my goodness, I am. Okay. Alright, so that is good, I think. Just kidding. Okay, I might have to redo this.
We'll just clamp it. I think it'll be okay.
Grab it. Oh, duh. We're good now. Okay, so obviously I wouldn't have done that in real life. I'm going to grab a paper towel because. All right. Well, that scared me. All right, so now I'm going to do my hand hygiene and do the secondary bag now. Got the hand hygiene all good. So, taking this, again, ensuring that it's levofloxacin, the right milligrams, right milliliters. This is my secondary tubing. Okay, perfect. The expiration date is not expired. I should probably do this real quick. Okay, so now I'm going to open this if I can. we don't need this thing, so I'm just gonna toss it. Toss in the tube, or the bag with that. And before I even hook up the actual, or before I spike the bag, there we go, I'm going to put the roller clamp on, as well as hook this side up to my cassette. Just gonna set that there. Alright, ensuring not to touch this part so it is still sterile. We are good. Okay, so now take the cap off. The roller clamp is on, perfect. Take this off, and now I'm going to pierce my bag, not touching either side. Alright, perfect, I got that. We are good. I'm gonna move this so it is not in our way. Okay, cool. So, now I can push this on, start, oh, did I just turn it off?
Nope.
Okay, no, we're good. And while I'm at it, I'm going to label my primary tubing as well as my secondary. So here is primary. Here is my secondary. And I don't remember if I said this during my preparation, my med preps, but I would have made sure that all of the medications are compatible with each other. There's no, what's it called? There's no interactions, all that stuff. Okay, so. Okay, so I'm gonna double check my MAR because I don't wanna mess up. Oops. Oh, it's beeping at me because this is clamped. And this is also clamped. Proximal occlusion at, pardon? Okay, well. Let me try this again. Okay, now it's doing the okay, we're good. So now I can do this. Okay, so we're gonna go for our primary line. So that needs to be run at 100 milliliters per hour, as that says on the MAR. The volume to be infused is 500, but just to be safe, to not inject air into our patient at the end, I'm just gonna do a little less than that, so I'll put 480. Okay, 100 milliliters per hour, 480 milliliters. So we're gonna do program options. We're gonna set that to standby. Yes, please. Perfect. So now we're gonna set up our second. And let's see, I'm going to change this to concurrent. Program options. Wait, go back. Let's see. Trying to back prime. Guess I should have already hit that. Oh yeah, I should have done that before. Let's just oh wait, go back. current, the rate. So according to the drug handbook, you're not supposed to do it any less than, or flow it at a rate of anything less than an hour. So we're gonna do 50 milliliters an hour, and the volume to be infused is 50 milliliters. All right, perfect. So we have 1 hour. Back. Okay, yeah, I definitely should have hit the back prime button before even entering any of this in. Let me, pardon me. Okay, I'm just gonna, oh, here we go. I figured it out. Okay. And again, I didn't do this in practice, but of course this happens during the test out.
Me too.
Alright, so now that I've back primed, I've ensured, pardon me, some bubbles in my secondary tubing, but I'm just gonna flick those out. Again, we don't want any air into Mr. James here. Okay, that is off. That is good. Just to be safe, we're gonna back prime one more time. Looking at these bubbles that snuck in there. That is not good. Alright, so we got all of that primed. Let me try this again. Alright, so I'm going to put it on, oopsies. There we go, concurrent, just so it can be put on standby while I get my IV inserted. So again, for the piggyback, the rate would be 50 milliliters per hour. The volume to be infused is 50 milliliters. That puts us at an hour total. Alright, so now we can go put into standby. Yes, please. Okay, now we are, let me just double check here. Okay, there we go. Just going to put it in standby, yes please. Okay, so we got all that good. So now we're ready to go into my patient's room. Also, just realized, it's okay. Alright, so now I have my name tag on, we're good to go. So now I can grab all my supplies, including the IV start kit. This, I'm going to wash my hands one more time just to be safe. Got an extra alcohol prep pad. It's got a couple extra catheters. We are going to take 3 pairs of gloves just in case one breaks or falls on the floor or something. Okay, so now we are ready to go into the patient's room. So again, this is going to be my tray. I'm not gonna drop anything. Okay. So I'm gonna set this down here, but I'm gonna do my K-wipes.
Come in.
Hello, my name is Chelsea Wrighton, and I'm gonna be your nurse today. Can I have you identify your name and date of birth?
James Wilson, and date of birth is correct.
Perfect, thank you. All right, so I noticed you have an allergy. Do you have an allergy to anything else?
Nope.
Perfect. So according to your record, you have an allergy to the NSAIDs, which we aren't giving you any of those today. So what we will be doing is I have an order from a provider that or to give you an IV. So I would have also brought this into the room with me. So this is in the room. Okay, so first we have a bag of sodium chloride, which is just fluid to keep you hydrated, help your fluid balance. And then connected to that is levofloxacin. That is just an antibiotic that will help fight off infections. And then as well as we have, alright, so that's connected to the same tubing that'll be put into your IV and just run throughout an hour, couple hours. And then lastly, I will be giving you a pain medication. I would also assess his pain. So how would you rate your pain on a scale of 1 to 10 right now?
6.
Okay, so since it's greater than a 4, I would go ahead and administer the pain med. So that is just hydromorphone, which will help you relieve your pain. Do you have any questions before we get started here?
Nope.
Perfect. Thank you, James. Excuse me. All right, so first I'm going to grab my stuff. Pardon. Okay. So I will have this at the side, along with my syringes, alcohol pads, and a couple extra needles, just in case I would need them.
So, knocked your mar.
Oh. Alright, so I would also have
Sorry.
my MAR with me. So, again, doing K-wipes. Also, during the K-wipes, I would have closed the curtain to provide some privacy, ensure he's safe. I did my education and all that fun stuff. So now I'm going to put on my gloves. All right, James, have you had an IV before?
Yes.
Okay, so you just kind of know how they run. So I will be putting this tourniquet on you to just find a vein to begin with. And I probably should have done this prior to since I already touched that. So I'm going to open up my packaging. Perfect. Alright, so now I will be putting a tourniquet on you just to find that vein. And I'm going to put that 4 to 6 inches above the insertion site. Alright, so that looks good. I would also ask, do you have a preference on which arm we use? Usually we do the non-dominant hand, just so you're not moving it as much.
Right hand is fine.
Alright, cool. So we did that. Then I'd assess the site for any inflammation, redness, tenderness, all that stuff, which it is good. So now we will go ahead and clean the site, sorry. And then I would also have the garbage over here.
Here, I'll move for you.
Oh, thank you much. Okay, so I would have the garbage prior to starting this. Alright, so first I'm going to clean your arm. After finding the vein, found the vein, we're good. So cleaning it in a circular motion from inward to outward for 30 seconds. Once I did that, I'm going to take off the tourniquet, remove my gloves, perform hand hygiene one more time. Alright, now I would also have the gloves over by me. Alright, so we're doing the gloves again. Now I'm going to prime my extension set with one of the saline flushes. Perfect. So here's my saline flush. And this hasn't touched anything, or the port hasn't touched anything yet, so I am okay to just to go ahead and put the saline flush in there. Otherwise I would have wiped it down. Alright, so we're gonna prime the tubing. Perfect. So the tubing is primed. I'm going to set that back down, cap my syringe, making sure not to touch the actual end of it, put it back in the bag. Okay, so now we have the site clean. We are going to put the tourniquet back on. And are you doing okay, James?
Yep, doing
Perfect.
just fine.
Wonderful. Good to hear. Thank you. So now, take out my needle. We're going to not touch the end, but just kind of wiggle it around, make sure that it is good. All right, James, you're just going to feel a slight poke. Are you ready?
Yep.
All right, perfect. So going in at a 30, well, with the bevel up, going in at a 15 to 30 degree angle, puncture the vein. I have some blood return, so I'm going to drop the angle and advance the catheter in. Oh, also I would have pulled the skin down. So now I'm going to take my needle out and dispose of that properly. I'm going to take out my the extension tubing. Here we go. That is already primed. So I'm just gonna pop this cap off and attach that. Perfect. And then I'll just leave that there, making sure it doesn't touch the table. Okay, so now I can go ahead and put the Tegaderm on. Excuse me. Also releasing the tourniquet. There, that's the word. So now I'm just going to put the Tegaderm on, holding that in place. Keeping this label out. We're good. We got it. Okay, so I'm gonna set the label there so don't forget about it. All right, James, how you doing so far?
Doing all right.
All right, perfect. Thank you. So first we are going to do our saline flush, but before I do that, I'm going to wipe down the port because it was out of the package and I don't know if it's technically clean or not. So I'm going to wipe off the port, making sure not to wiggle the catheter around too much for discomfort. Okay, so first I'm going to do my saline flush. Not touching the plunger. So I'm going to unscrew that and then push in my saline flush, but for testing purposes, I'm not going to actually push it in. Okay, so this is pushed in, and then I would dispose of that as well as that. So now we're ready to push in the med. How you doing, James?
Still doing all right.
Perfect. Glad to hear that. Thank you. I did touch the end of the port. And since I already did the saline flush, I'm going to disinfect that for about 30 seconds. And I'm going to find my med. Here it is. So I'm going to take out my med. After disinfecting the port, I'm going to inject the med. And according to the drug handbook, I would push it in at a rate of 2 to 3 minutes. So I'm pushing it in, the 1 milliliter, in at a rate of 2 to 3 minutes. So once that is pushed in after 2 to 3 minutes, I will dispose of that. I will take one more alcohol pad. And I'd probably have my garbage over here so I'm not reaching over. Okay, so I clean the port off, and here is my last saline flush. Take that out and administer it at the same rate of my med, which is 2 to 3 minutes. So once I push that over 2 to 3 minutes, now I am ready to tape. So I'm going to be taping using the chevron method, also making sure that doesn't hit the table. So I will put that in right there. Also, I probably should have had the Tegaderm covering more of the hub, which I didn't realize. But that's okay, because we got tape. So now I'm going to tape over the clear part. And just because I'm not feeling too confident about that, I'll tape over the blue part as well. Otherwise, in real life, the Tegaderm would have covered that. So then we are going to tape in a J shape the extension set. Also, I'm going to clamp that off so nothing really runs out, because that would be bad. So, just because that tape was so thin, I'm just going to tape it one more time like that. Okay, so now I'm going to clean up my area a little bit. You still doing okay, James?
Yep, just
Perfect.
hanging out.
All right, glad to hear that. I probably should have left on my gloves, but you know, just to be safe, I'm gonna put on another pair of gloves. Okay, so now we will be moving over to the mannequin. Put on a new set of gloves just to be safe after doing hand hygiene. Okay, so now I'm gonna take one more alcohol wipe. I'm going to dispose of that. Oops, not gonna run into the table. All right, so now I will take the tubing. I'm going to disinfect this one last time. And now I'm going to take off the tube. Insert that in. Make sure that's not clamped off. And then I will start my IV. Oh, oopsies. Let me try that again. Sorry, I'm going to start all. I accidentally hit start A. So it is starting both lines as it's flashing. So now I'm just gonna stop because of testing purposes. We're stopping all. Okay, but as it would run, I would tell, or it would run as I'm doing this. Okay, James, so I'm going to be back in about 30 minutes just to check on you. How are you doing otherwise?
I'm doing okay.
All
Not
right,
too
perfect.
painful.
All right, that's good to hear. So I would make sure that the call light is in place, that he has everything he needs, ask him if there's anything else I can do, make sure he's in a comfortable position, he's safe, he's good. So then I would go to my documentation and I would write down what I all had administered. Just kidding. You know, I almost forgot to label my thing. Okay. So I would do my initials. This is kind of hard with my pencil. The date, the gauge, which is 22, G for gauge, and then I'll do the time because why not? All right, so I have that labeled, and I will put that label on here. Also doing that before I even went to turn on the pump and put the IV or the IV tubing in. Okay, so then I would go to my MAR document. And yeah. Okay, so we got so I would also document what I gave. 800. I would say it was put in the left forearm. The date, time, 22 gauge, left forearm, and initial for all of those. And yeah.